Hello, and welcome to this interactive session on joint function in hemophilia. This is an animated guide which will take you into the knee joint to show you what actually happens during a bleed. We will showcase a healthy knee, review important information and facts on joint bleeds, show you the complications that can arise, and share ways to optimize therapy. Let's start with a brief overview of joint bleeds. Joint bleeds are the most common complication in hemophilia, accounting for up to 85% of bleeding episodes in patients. Bleeds can occur in elbows, ankles and knees, but knees are the most common. They can happen as a result of an injury or can happen without any type of injury. Joint bleeds usually begin by age 2, when the child begins to move around more often. Let's look first into a healthy knee joint. There are 4 main bones to the knee: femur or thigh bone, tibia, also known as your shin, the fibula, and patella or kneecap. The cartilage that surrounds the ends of the bones protects them from the constant friction of movement in that joint. There is a tissue that surrounds the joints called the synovial membrane or synovium. The synovium produces synovial fluid, which works to lubricate the joints and keep them working properly. The clear fluid allows the cartilage between the bones to slide back and forth without any damage to the joint. Normally, there is no blood in the joint space, and the synovial fluid gets replaced frequently to keep the joint healthy and functioning. Maintaining healthy cartilage and synovium is key. Now, let's look at what happens in the knee during an acute bleed. Joint bleeds can occur spontaneously or be caused by an injury. You can see the blood beginning to leak into the joint space. The bleed should be treated quickly, ideally within 2 hours. In case of delayed treatment, the synovium becomes inflamed as blood accumulates in the joint space and the joint begins to swell. As the blood accumulates, the body attempts to break down this blood to remove it from the joint space. The blood is broken down to waste products and iron. This waste and iron that are left behind is toxic to the cartilage, synovium, and bone. If the bleed is not treated quickly or adequately, the bleeding continues and creates an enlarged, painful, and eventually immobile joint. If this were the only bleed, the synovium would be able to reabsorb the blood over time and the joint would heal. However, repeated bleeds into the same joint cause a vicious cycle. And each time a bleed happens, the waste and iron accumulate in the joint, causing further damage and immobility. Some of the iron and waste products are left deposited in the joint space. This damaged joint is then more likely to bleed. Over time, the repeated bleeds cause chronic inflammation that has lasting complications on the joints. The accumulated waste and iron are toxic to the cartilage, bones, and synovium. As a result, the synovium thickens and grows tiny finger-like projections called microvilli. The synovium, with its small finger-like microvilli, are now more prone to getting pinched between the moving bones, resulting in a bleed. This early stage of joint damage where there is inflammation is called synovitis. As a result of this synovitis, the synovium no longer functions correctly. Thus, it is unable to lubricate the joint properly or remove the blood from the joint. Blood also has a toxic effect on the cartilage and prevents it from repairing itself. As this happens, the joint may form bony cysts with a loss of bone mass, leading to further pain and immobility. With repeated uncontrolled bleeds, there is more damage to the synovium and cartilage until the joint is unable to move. It resembles a crippling type of painful osteoarthritis, and the damage becomes permanent. The damage to joints caused by repeated bleeds gets worse over time, causing pain and reducing range of motion. However, there are simple things that can be done to actively look after the health of joints. By recognizing the early signs associated with a joint bleed, action can be taken to stop it. Pain, warmth in or around joints, swelling and stiffness are all signs to be aware of. Check joints regularly for any changes in how they move or feel. If you feel something, do something. When a bleed is detected, it is important to treat with factors as soon as possible. Early treatment means less blood in joints and fewer complications over both the short and long term. Besides treatment with factors, other options to treat a joint bleed can include protecting the injured joint from undue stress, resting the joint for at least 24 hours, applying ice for 15 to 20 minutes every 2 hours, compressing the joint using a bandage or compression stocking for the first 24 hours, elevating the joint. Treating bleeds early is very important. However, there are simple things that can be done to actively look after the health of joints and so limit the impact of joint damage. Lifestyle choices, such as keeping fit, maintaining a healthy weight, and being more aware of what activities help or harm joints, are all part of protecting joints from damage. Doctors, hemophilia specialist nurses, and physiotherapists have lots of different ways to help people with hemophilia keep their joints healthy for longer. This concludes the Joint Function in Hemophilia presentation. If you have any other questions, please talk to your doctor or hemophilia team. Thank you for joining us.